Good morning and welcome to MedFacts YouTube channel. Today we are going to talk about the diabetes, not merely diabetes, but we are also going to talk about another condition what we call pre-diabetic. If you have never checked your blood sugar level, then I recommend you, strongly recommend you, please check your blood sugar level. If your blood sugar level is within normal range, then congratulations. But if you are either pre-diabetic or diabetic, you have to take care of yourself. So it is a free channel which you can subscribe, and also we can discuss. You can also ask any question from me. So what is the meaning of the pre-diabetic? You have to go to your doctor, and if you are fasting for 8 hours, he will check your blood sugar. If it is below 99, congratulations, you are neither a diabetic nor a pre-diabetic. So but if it is above 99, it's mean you are qualified, either you are having pre-diabetes condition or you are having diabetes, so you have to take care. So if it is above 125, it means you are diabetic, but I will always recommend to check it twice. As you can look at this picture, we can see that the number of patients suffering from diabetes is increasing. Why? Because of our lifestyle. We are having a sedentary lifestyle, and also we are not eating a healthy food. So these all things are affecting, and this number is increasing. It is for 2014, but also in 2017 or 18 also it is increasing. So why it is important, why I am here to talk about the diabetes or pre-diabetic condition. If you are having diabetes or pre-diabetic condition, it is not going to kill you in a day or in a month, but we have to look at what will be the future of this condition. If you are not going to control your diabetes well, you can land up with many complications and many health problems, such as you can damage your eye, brain, heart, your nervous system, and your kidney as well, in the form of, like, you could have diabetic retinopathy, brain attack, heart attack, nerve damage, and also you can develop your kidney failure as well. So we already talked about the fasting plasma glucose level, and if you already took your food and after 2 hours if you checked, and if it is below 140, congratulations, you are in a normal range. But if it is above 140 and below 199, it's mean you are pre-diabetic. You have to do something, okay? And if it is above 199, it's mean it is 200, it's mean you are diabetic. So here you are in the red zone. So I also strongly recommend to check it twice. But if you have a symptom, yes, you are no need to go for another test. Here pre-diabetic, it is a very alarming situation that many people are having this condition, but they are not aware of it. And if you are having this condition or you are not taking care of yourself, then maybe this pre-diabetic condition can be changed into full-blown what we call diabetes. So here you can see that the 1 out of the 3 person in USA are pre-diabetic. A large number of people are having diabetes. So that is why I am telling you, I strongly recommend you to please check your blood sugar level. So next, what if you are having diabetes? First of all, I will recommend you to please go to a qualified doctor. Please don't go to the person who is not believing on evidence-based science. This is, my friend, it is evidence-based science. Whatever I am talking is all evidence-based science. I am not talking any jargon. So here you can see that what we can do if you are having pre-diabetic or diabetic situation. Then you have to control your diet. You have to go to your dietitian. They can give you a good suggestion. If you are not in good shape, you have to lose your weight, and yes, exercise of course make a big change in your life. So all these things, if it is you are doing all this and your diabetic or pre-diabetic condition is well controlled, then congratulations. If it is not working, then you have to go for the medication, either in the form of tablet or in the form of injection. Again, I will tell you to please don't get scared if your doctor is suggesting you insulin. Nowadays, according to new recommendation, even insulins can be started in the early phase as well. Please don't get scared. It will be not painful and it is essential for you. So I already told you that there must be a target which is fixed by your doctor, and that is HbA1c. Now WHO is also recommended HbA1c level for diagnosis of diabetes and pre-diabetic, and this is the normal range. If your HbA1c is 5.7, below that, congratulations, you are not diabetic. So what is the main important point here that I am going to talk is, that is HbA1c level. Any qualified doctor will always talk to you about HbA1c level, and HbA1c level different has a different target level for the different people. It is not necessary that if doctor has set it 7 for the someone, it will be same for you. If you are young, maybe it will be 6.5 and even 6 for a person who is very young, because we are looking at your future, and we are looking at your future so that you should not have any kind of the complication in your future. So your HbA1c, any qualified doctor must set your HbA1c. And my dear friend, I am telling you, believe me, that it is not the doctor who can achieve this target, it is only you. You are the, the key person which do something and do a miracle and change his HbA1c into a normal range, right? Yes, doctor is always be there and will be helpful for you. So I highly recommend you to please consult your doctor and who is qualified. Next is, if you developed a depression, yes, it need to be treated as soon as possible. That will help to control your diabetes as well. Last but not least, that is about your cholesterol level, and if your doctor thinks that you can develop any complication related to your heart or your brain that we call cardiovascular disease, he recommend you for the statin. And I also suggest you highly to take a statin therapy if there is a chance to develop a stroke or a chance to develop heart attack. So that's all, my friend. If you want to give any comment, you are most welcome. If you have any question, you are most welcome. Thank you very much. I oblige if you will subscribe to me. Thank you very much.